What's the first thing that comes to mind when you hear IVF treatment? Is it a guaranteed baby, a risky procedure, or a quick fix to infertility problems? Let's debunk some common misconceptions. In vitro fertilization, or IVF as it's commonly known, is often wrapped in a shroud of myths and misconceptions. Some of these are as old as the treatment itself, while others are products of misinformation or misunderstanding. Let's take a few minutes to address some of the most widespread. One of the most common myths is that IVF always leads to twins or multiples. Yes, IVF does increase the likelihood of multiple births, but it's not a guarantee. The number of embryos transferred during the procedure determines this. More embryos mean higher chances of multiple births, but it's not a given. Another misconception is that IVF is only for older women. It's true that IVF is often a choice for women who have difficulties conceiving naturally due to age. However, it can also be an effective treatment for younger women with various fertility issues. Age is just one factor among many. Perhaps one of the most deceptive myths is that IVF is always successful. It would be wonderful if that were true, but unfortunately, it's not. Success rates vary widely depending on factors like age, fertility health, and the quality of the embryos. IVF is not a magic bullet, but it does offer hope where there was little before. The myth that IVF is too risky is also pervasive. Like any medical procedure, IVF carries some risks, including ovarian hyperstimulation syndrome and multiple births, which can lead to complications. However, with careful monitoring and advances in technology, these risks are significantly reduced. It's important to remember that everyone's journey with IVF is unique, and what works for one person may not work for another. IVF is not a one-size-fits-all solution, and it's not without its challenges, but it can be a viable path to parenthood for many people. As we can see, not everything we hear about IVF is true. Now, let's delve into the actual IVF process. IVF, or in vitro fertilization, is a complex, multi-step procedure. It's a journey that unfolds over several weeks, each phase bringing you a step closer to the possibility of parenthood. Let's walk through this process together, step by step. The first step, even before the actual treatment begins, is the initial consultation. This is when you'll meet with your doctor to discuss your medical history, perform some preliminary tests, and outline your treatment plan. It's a crucial step where you get to ask all your questions and set your expectations. Once you've cleared the consultation, the next step is ovulation induction. This is where the magic, or rather the science, really begins. You'll start taking fertility drugs to stimulate your ovaries to produce multiple eggs instead of the usual one. This process is monitored closely with blood tests and ultrasound scans to ensure the eggs are developing correctly and to determine the perfect timing for the next step. Now we're at the third step, egg retrieval. This is a minor surgical procedure. Using ultrasound imaging as a guide, a thin needle is inserted through the vagina and into the follicles to retrieve the mature eggs. While it may sound daunting, it's usually done under sedation and is typically painless. With the eggs safely collected, we move on to the next step, fertilization. This is where the sperm meets the egg, but in a lab, not in the body. There are two methods for this: conventional insemination, where the sperm and eggs are mixed together and left to do their thing, or intracytoplasmic sperm injection, where a single sperm is injected directly into each egg. The chosen method will depend on the specifics of your case. Next up is the embryo transfer. This is when the fertilized eggs, now embryos, are transferred back into the uterus. It's a quick, usually painless procedure that doesn't need anesthesia. A speculum is inserted into the vagina, and a thin tube, or catheter, is passed through the cervix into the uterus. The embryos are then passed down the tube and into the uterus. After the embryo transfer comes the most nerve-wracking part of the process, the 2-week wait. This is the time between the embryo transfer and the pregnancy test. It's a period of anticipation where you wait to see if the embryos have implanted and pregnancy has begun. It's a roller coaster of emotions, and it's perfectly normal to feel a mix of hope, anxiety, and impatience. And finally, after those long 2 weeks, it's time for the pregnancy test. This is usually a blood test done at the clinic, which can detect pregnancy earlier and more accurately than home pregnancy tests. If the test is positive, congratulations, you're on your way to becoming parents. If it's negative, don't lose hope. IVF is a journey, and sometimes it takes more than one cycle to reach the destination. And that's the IVF process in a nutshell. It's a journey that requires patience, resilience, and a whole lot of hope. It's a process that can seem overwhelming, but remember, each step brings you closer to the dream of parenthood. And no matter where you are on this journey, know that you're not alone. There's a whole community of people who've walked this path before you, and they're cheering you on every step of the way. So we've busted some myths and walked through the IVF process, but what are the key takeaways here? Firstly, it's important to remember that IVF is not a guarantee of success. It's a medical procedure with its own set of risks and potential outcomes, much like any other. It's key to go into it with a balanced mindset, understanding that while it has the potential to create miracles, it doesn't promise them. Secondly, IVF is not just for older women. While age does play a significant role in fertility, IVF has been successfully used by women of various age groups. It can be an option for anyone struggling with fertility issues, regardless of their age. Thirdly, let's dispel the myth that IVF always results in multiple births. While it's true that IVF increases the chances of having twins or triplets due to the common practice of transferring more than one embryo, it's not a given. It's also worth noting that strategies are being implemented to reduce the number of multiple pregnancies, such as transferring fewer embryos and improving embryo selection. Fourthly, the IVF process is a step-by-step journey requiring patience and resilience. From initial consultations and tests to egg retrieval and embryo transfer, there are many stages to navigate. It can be a long and often emotional process, but remember, it's a journey you're not undertaking alone. Lastly, it's crucial to embrace the emotional aspects of the IVF journey. It's okay to feel a roller coaster of emotions. There will be moments of hope, anxiety, joy, and possibly disappointment. Seek support when you need it, whether from friends, family, or professional counselors. Each of these points emphasizes the importance of personalized, informed decision-making when considering IVF. It's a journey that's different for everyone, filled with its own unique challenges and triumphs. Remember, every couple's journey is unique. If you're considering IVF, it's crucial to consult with a medical professional to understand the best path for you.